Hello dear kids, welcome back to the social science class, and today we are going to learn a new chapter from civics, that is working of the state government. The state government is responsible to ensure that citizens are provided with proper health care, education, employment, roads, drainage and electricity. And the states have the responsibility of raising the level of nutrition and the improvement of public health. And in this chapter, we will look at the functioning of the state government through the example of healthcare. So today we are going to discuss about the welfare functions of the state government, how public health services and private health services work in India, why there is inequality in healthcare distribution, etc. So let us have a look into the mind map. Working of the state government, what is health, and we will discuss healthcare resources in India, private health services, and is there equality in healthcare services or healthcare facilities and healthcare in India today. So let us learn together. The health of individuals is their most important asset, right? The World Health Organization, we all are familiar with the same, right? WHO states that the enjoyment of the highest attainable standard of health is one of the fundamental rights of every human being without distinction based on race, religion, political belief, economic or social condition. Okay, health is a matter of human rights and its violation should be seen as a violation of human rights. Therefore, it's crucial that the state plays an active role in providing health care to the people. And do you know what is health? When we think of a healthy person, the first thing that comes to our mind is that of a person who is physically fit and free from illness. However, health is not just confined to physical fitness, but also means mental well-being. A person who is free from any fear or anxiety is seen as a healthy person. The World Health Organization defines health as the state of complete physical, mental and social well-being, and not merely an absence of disease or infirmity. And in recent years, health is also seen as the ability to lead a socially and economically productive life. That is health. In order to attain total health, factors like availability of nutritional food, clean drinking water, and an environment devoid of pollutants also play a key role. Now let us see healthcare resources in India. For a healthy life and during illness, there is the need of appropriate healthcare services like hospitals, health centers, laboratories, ambulances and blood bank. We also need well-trained doctors, nurses, health workers and paramedics to diagnose and treat the illness. And besides this, medical equipment, machinery and medicines are needed for treating the patients. Making such a resources available is the responsibility of the government. And let us see the delivery of healthcare services. So in India, the healthcare services are provided into two ways. First is, public health service, and the second, private health service. Let us see the first, public health service? The government. The government is responsible for providing public health services both in rural and urban India. The government establishes hospitals and healthcare centers across the country which are equipped to provide treatment for all kinds of illness. Our public healthcare policy envisages a three-tier structure comprising primary tier, secondary tier, tertiary tier. Okay, so these three tiers are to bring services within the reach of the people. Let us see the first, primary tier. It is designed to have three types of healthcare institutions, namely a subcenter, SC, subcenter for a population of 3,000 to 5,000. And the second is a primary health center, PHC, primary health center for 20,000 to 30,000 people, and a community health center, that is CHC, community health center, as referral center for every 4 PHC, that is primary health center, covering a population of 80,000 to 1.2 lakhs. Okay, the health centers in the villages are handled by trained nurses and a village health worker. They all work under the supervision of PHC doctors. Clear? And the second is secondary tier. The district hospitals functions as a secondary tier for the rural health care, as the primary tier for the urban population. Secondary is for the rural health care. Okay, they supervise the rural health centers. And the third, tertiary tier. This healthcare is provided by healthcare institutions in urban areas which are well equipped with sophisticated diagnostic and investigative facilities, that means latest technologies. In pursuance of this policy, pursuance means in pursuance of this policy. What do you mean by pursuance? Pursuance means to follow. To follow this policy, a vast network of healthcare institutions has been created both in the rural and urban areas. Substantial resources have gone into planning and implementing the health and family welfare programs. And public health services are called so. Public health services are called so because they are meant for all the citizens of the country, be it in rural or urban areas. So this is for the common citizen or all the citizens of the country. They provide healthcare facility either free of cost or at a low rates to the poor. The construction of these hospitals and healthcare centers is done through the money that the public pays in the form of taxes that we are paying to the government. The required medical equipments and medicines are also funded by the government. Prevention of diseases like tuberculosis, malaria, jaundice and cholera is also a part of public health. Now it's Corona too, right? The universal immunization program is also an initiative taken by the government to provide vaccination to prevent diseases such as polio, measles, diphtheria and others. And the Constitution of India clearly states that the welfare of the people and providing them health facilities is the primary duty of the government. Now we will move to the next topic, that is Private health services. Private health services are offered by individuals and are profit oriented. Remember, private health services are offered by individuals and they are profit oriented. Private health facilities include laboratories with all kinds of new equipments to provide facilities for diagnosis such as X-ray, ultrasounds, blood test, etc. Several doctors have set up their own private clinics in urban and rural areas. The number of such private practitioners is more than in urban areas than in rural areas. The infrastructure in the private health services is much better than the public one. In fact, the private sector, despite being costlier, provides 80% of the health services in the country. Though they are so costly, but 80% of the health services are provided by the private sector. And in recent times, private healthcare facilities have been established in every nook and corner of the country. Many hospitals offer superior treatment and facilities and charge heavy amount of money for their services. Medicines are also sold at several private shops which are costlier than the one that are available at government dispensaries. This has resulted in big private companies investing in manufacturing and making of medicines or marketing of medicines. Now let us see, is there equality in healthcare facilities in India? In the absence of adequate public healthcare facilities, the growth of private healthcare sectors has been largely seen as boon. Boon means a timely benefit. But in reality, it has created stark social and economic differences. The private healthcare sectors or the private healthcare sector is driven by profits and therefore is very expensive. This limits the access of private healthcare facilities for people from the economically weaker sections of the society especially. The increasing cost of healthcare and medicines is making healthcare unaffordable for a growing number of people. For the poor in the country, since the very basic facilities of water, nutrition, sanitation and housing are missing, they tend to fall ill more frequently. Each illness brings more distress and anxiety to them as money has to be spent on health care. Further, women also face inequality in health services. Often the health of women is considered less important than the male members of the family. Right? Then, health care in India today. Health standards of a country reflect the social, economic, political and moral well-being of its citizens. Economic and social growth of a country or a society is directly dependent on the health of its citizens. Hence, it is important that healthy living conditions and access to good quality health care is provided by the government. It is not only a basic human right but also a prerequisite for the social and economic development. Our current healthcare system lags behind in meeting the healthcare or the needs of the people. It should be made accessible to all, available to all. However, health is much about the healthcare facilities as about the social and economic condition of the people. Therefore, both need to be worked upon simultaneously. To be able to achieve the goal of providing healthcare facilities to all, both the government and the private services as well as the people have to come together. So let us look at two examples where this has been carried out successfully. For this, you can read the case study given in the page number 223. Okay. So dear kids, as we all know, health is wealth. If you don't make time for your wellness, you will be forced to make time for your illness. And remember, someone else in this world is dreaming about the things you take for granted. Okay, so if your body is not right, the rest of your day will go all wrong. So take care of yourself. Bye bye.